Hello, my name is Dr. Brenna Kavanaugh. I am a clinical psychologist and board certified behavior analyst at the University of Rochester Medical Center. I work in the Division of Developmental and Behavioral Pediatrics. I am also a member of the Rochester Regional Center for Autism Spectrum Disorders. Today, I'm going to be sharing a brief presentation on autism spectrum disorders and comorbid mental health challenges. In today's presentation, I'm going to cover how common mental health disorders are in individuals with autism spectrum disorder. We're also going to talk about some of the most common mental health challenges that individuals with autism might face. And we're going to talk a little bit about what mental health disorders might look like in individuals with autism spectrum disorder. Today's presentation is going to cover foundational information, and the presentation is geared towards mental health providers who may or may not be currently seeing patients or clients with autism in their mental health practice. And I encourage you, if you want to learn more about autism spectrum disorder in general, to watch our Introduction to Autism presentation that we also have posted. So how common are mental health disorders in individuals with autism spectrum disorder? The short answer to this is they are common. So individuals with autism experience the same emotions that everybody else experiences. They might just present those emotions a little bit differently from the general population. And it's important to remember that individuals with autism can experience the same mental health challenges as everyone else. And mental health disorders do not discriminate. So an individual with autism can have any mental health disorder that anyone else can. And this applies to individuals on all ends of the spectrum. We also know that some mental health conditions seem to be more common for individuals with autism than they are for individuals who don't have autism. For example, we know that anxiety disorders are actually more common in individuals who have autism. And there might be a number of reasons for this, such as social risk factors that individuals with autism face or social experiences, deficits and differences that they have in their thinking and problem-solving abilities, as well as differences in emotion identification, recognition, and processing. Some of the most common mental health challenges that individuals with autism might face are ADHD, anxiety or anxiety disorders, depression and mood disorders, as well as difficulties with anger, irritability, and other disorders of conduct. And I'm going to go into each of these briefly today. Perhaps the most common comorbid condition that an individual with autism may present with is ADHD, or attention deficit hyperactivity disorder. It is estimated that up to 60% of individuals with autism also meet DSM criteria for ADHD. Many symptoms of ADHD and autism spectrum disorder can overlap. For example, poor engagement might be seen in an individual with autism. Poor engagement can also be a symptom of ADHD. However, we do know that for individuals with autism who present with significant ADHD symptoms like inattention, hyperactivity, and impulsivity, addressing these ADHD symptoms separately with separate intervention can still be beneficial. So for example, an individual with autism that has significant ADHD symptoms can still benefit from things like medication that target ADHD and behavioral interventions that target ADHD symptoms. But of course, this can vary from individual to individual. I also want to note that having ADHD with or without a diagnosis of autism is a risk factor for other mental health conditions. So we know that individuals with ADHD are more likely to experience mental health conditions like anxiety and depression throughout their lifetime. As I mentioned previously, anxiety and anxiety disorders are also a common mental health condition that individuals with autism might experience. And it has been estimated that up to 40% of individuals with autism are also diagnosed with an anxiety disorder. And this is compared to 15% in the general population. Some of the most common anxiety disorders that an individual with autism might experience are specific phobia, which is actually the most common, generalized anxiety disorder, and social anxiety disorder. However, identifying anxiety in an individual with autism can be challenging. There are many overlapping symptoms between anxiety and autism spectrum disorder. So we see that individuals with anxiety disorders might present with difficulties in social settings and increased social withdrawal. But we also know that this can be a symptom simply of autism with or without anxiety. We also see that individuals with anxiety might present as increasingly rigid and be resistant to change. These individuals might have difficulty with transitions and adapting to change and differences. And we might see individuals with anxiety have some more repetitive and compulsive behaviors. Again, all of these things are things that we might see in individuals with autism who don't have anxiety. So teasing apart what's a symptom of autism versus what's a symptom of anxiety can be really difficult. We also know that sometimes anxiety can actually present as more exacerbated or exaggerated symptoms of autism. So an individual with autism who's experiencing anxiety may present with more rigidity, more repetitive behaviors, more sensory sensitivity, and increased social withdrawal. Again, anxiety disorders can be really difficult to assess in an individual with autism. A lot of times an individual with autism might have difficulty labeling and communicating their anxiety emotions to you. Sometimes these anxiety emotions might present as more physical or somatic complaints, such as headaches, fatigue, stomach aches. Symptoms of anxiety can also present as externalizing behaviors for these individuals, such as increased irritability, emotionality, challenging behaviors, defiance, temper tantrums. These can all also be signs of anxiety in an individual. It's also important to note that anxiety can sometimes present a little bit differently in individuals with autism. For example, we often see that individuals with autism with specific phobias present with some atypical specific phobias, or specific phobias that you might not see as much in the general population. For example, it's not uncommon for an individual with autism to have a specific phobia to certain sounds or certain songs or certain characters on television, and this isn't often something that you see in the general population. Individuals with autism may present with worries that are a little bit different from the typically developing population. For example, their worries that are a part of their generalized anxiety disorder might look a little bit different than other people's worries. I wanted to just note that it's not uncommon for an individual with autism to present with ADHD and anxiety. So this combination of these three disorders is not an uncommon combination to have. I wanted to just touch on OCD, or obsessive compulsive disorder, and autism spectrum disorder. So individuals with autism can display ritualistic, repetitive, and compulsive type behavior. However, these behaviors are often a part of their diagnosis of autism and are most often not due to a separate disorder like obsessive compulsive disorder. And so differentiating someone's repetitive behaviors from symptoms of OCD can be really challenging. Another common comorbid condition that individuals with autism might present with is depression. So it is estimated that individuals with autism are 4 times more likely to suffer from depression in their lifetime than the general population. And again, this might be due to a number of additional social risk factors that they might experience in their lifetime, as well as differences in thinking and problem solving abilities. Just like anxiety, diagnosing and assessing for depression in an individual with autism can be challenging and it can be difficult to detect. Again, a lot of symptoms of depression and autism spectrum disorder can overlap, such as social withdrawal, narrowing of interest, irritability. These are all things that can be seen in an individual with autism who doesn't have depression. So you might look for and assess for depression more when you're seeing an individual present with a change in their functioning. So this individual might present with increased social withdrawal, even more narrowing of interest, increased irritability and emotionality, as well as sleep and eating changes. And finally, another condition that might present frequently and in your practice is individuals with autism who also present with difficulties with anger and irritability. And this is especially true if you're seeing children with autism spectrum disorder. It has been reported that 81% of caregivers of children with autism indicate that irritability is a primary concern for their child. And so addressing behavior challenges and irritability is often a target of treatment. Some common behavior challenges that you might see in individuals with autism are things like aggression, self-injurious behavior, temper tantrums, defiance, and noncompliance. And these behaviors could be a symptom of another mental health diagnosis, like disruptive behavior disorder, intermittent explosive disorder, or oppositional defiant disorder, or it could be a secondary feature of the individual's autism. So in summary, many individuals with autism will face other comorbid mental health challenges throughout their lifetime. And we do know that individuals with autism might actually be more likely to be impacted by some mental health disorders like anxiety and depression. And this might be due to a number of factors. Assessment, identification, and diagnosis can be challenging for a number of reasons. Many symptoms of mental health disorders can overlap with symptoms of autism. Sometimes mental health disorders can present differently in individuals with autism, and many individuals with autism might have difficulty expressing their emotions and identifying their emotions for you. So keep in mind that clinical expertise may be needed for diagnosing other mental health conditions, and that your assessment and intervention should always be tailored to the unique individual presenting to you. If you want to learn more and want to help us improve mental health care for individuals with autism, consider participating in our mental health and ASD Echo. So through our mental health and ASD Echo, a team of experts on autism will help guide a group of mental health practitioners like yourself who see patients with autism in their mental health practice. We will be meeting for 1-hour meetings every 2 weeks virtually. And in these meetings, you'll participate in didactic trainings on autism and mental health, as well as receive case support. Through the Mental Health and Autism Echo, you'll also become part of a professional network of local mental health providers supporting one another to provide effective and evidence-based mental health services to individuals with autism. If you're interested in learning more about our ECHO, contact Jennifer Ward at Jennifer_Ward at urmc.rochester.edu. Thank you.